Good morning. I got asked by Microlab I know that the system, Epic, is a lot different than the old surgery system as far as putting in orders. But they're getting an awful lot of orders where incorrect tests are ordered, or they're not being ordered at all. They're just putting in a test under comments. And to that end, we made a list of all the tests that you should be seeing in surgery, which are the little name badge cards she was talking about. And I wanted to talk a little bit about some of the cultures that were being ordered wrong. We get an awful lot of body fluid cultures and tissue cultures that are not truly tissue or body fluid. If you order a body fluid culture, it should be thoracentesis, paracentesis, pleural, or synovial. If it's not one of those, then it probably falls under another category. Tissue cultures, unless it's an actual piece of tissue, should be a wound culture. And we get an awful lot of tissue cultures that are really swabs from a wound. We have separate eye and ear cultures. So if you get, swab some ear fluid, it would just be an ear culture. And I said the only other real problem we had was, I had a couple of examples where all we got ordered was a gram stain, and under comments they put aerobic, anaerobic. So we have to have a separate order for each individual test. We have to have the gram stain and aerobic would be, we don't really have an aerobic culture. We have, the wound, tissue, bone, ear, genital, spinal fluid. Yes, ma'am.
Have you seen what we look at in Epic? Because there is not that to choose from. That is not, that's why you're getting this stuff in the
right.
Because it says gram stain, and then you've got routine culture. You don't have ANA, CNS, you don't have those listed out. So you can't order it if you don't know.
Right. And unfortunately, I don't even have access. With net access, I could look at everything. With Epic, I have absolutely zero order capability. So, but I can get with the girl at Epic and see if they can get your pick list.
Well, see, that's a problem because what you have and what we have are two different things. And if we can't order it what we need, that's why we're going to put it in the comment field so that you know what we need.
Well, I think you can always go out and search for it,
No,
even
ma'am.
if it's not in your pick list.
No, ma'am, you cannot. You've got a whole room telling you. We cannot.
Well, that
and
I'll
also
have-
body fluids. When we don't necessarily get, do abdominal and rectal and stuff like that. I get body fluids from within the cavity. So it is a fluid. What would you tell me to put it as? Because I only have choices of tissue and fluid and like two other things. So I'm like,
if it's actual fluid
is.
that you're sending, then it can be a body fluid.
well, that's what we put it as. So you can't
We've
say
gotten
that
ear drainage.
It's only going to be these choices.
One of our big things was getting ear drainage on a swab that they were putting in as a body fluid culture. We've had pieces of tissue come down where they just picked body fluid culture. But I will have to get with the Epic girl about what you actually
that's the
see.
thing is y'all need to see what we see so that you understand that we're not trying to be a pain in your ass.
Oh.
We're just trying
to
get things ordered. And because I've talked to many people down in lab and they're going, but that's not what we have. That's not what we have. Well, I'm sorry that's not what you have. I know you're on a different system.
Right.
Whoever created the Epic in your system should have communicated that.
We don't have Epic.
I know you have Sunbelt or something like that.
Yeah, we don't have Epic at all.
Sunquest.
So,
So,
Evidence, I've talked to her. We're trying.
right. Well, this is the first I'd heard that there's not that you can't find it. And I think basically after the first few weeks, they just started fixing them and quit calling. So nobody's been aware, and I guess Amanda maybe is the Epic. I can get with Amanda Cowan and find out why you can't pull them up. So, but now some of them, I mean, I know that we get orders for wound and orders for tissue and orders for bone, and they're just kind of sometimes picking it inappropriately.
There is no wound culture to choose from.
Mm,
That's not even an
interesting. Okay, well, here again, like I said, that this is something I didn't know. And like I said, I wish I could get into Epic and look at what, because I get calls all the time from all over the hospital about different things.
Why don't you all have Epic? If we're supposed to be one patient, one chart throughout the whole system, why aren't you all on Epic?
Because Epic's lab product wasn't robust enough, so they decided to keep Sunquest and interface it with Epic. We may eventually move to Beaker, which is their lab product, but their microbiology system is not nearly what Sunquest is, and they have no blood bank at all in their lab system. So they made the decision not to move us to Beaker. Okay, well, I will get with Amanda and find out why they can't get to these.
Okay.
That's interesting because,
It is.
like I said, nobody
Nobody said
said
anything.
anything. So thank you for that, because that's good information. And thank you.
Thank you, Teresa.
I have a question.
Yes, ma'am.
Thank you. When I choose routine culture,
That routine culture is not supposed to be an option.
okay.
They were supposed to take that away,
Okay, so never mind.
okay, yeah, they were supposed to, yeah, that was, are you still able to find that? Because they've told me 4 times that they've made that go away.
Because I was told like routine culture did anaerobic, gram stain and CNS.
No. Routine miscellaneous was something we had out there if they had some weird culture that we don't have set up, that we may allow, that we had something to put. It was just kind of, it's like miscellaneous lab test.
Okay.
So, and that's supposed to be used by lab only. Did you say you can still find that?
Yes, ma'am.
Okay.
I got a note.
Ha, ha, ha. Now, I'll get with, I know just who to call about that too.
Kendra got a question.
Okay.
Okay. Okay, so I just want to know what you're saying is like, so we're supposed to do a separate order. So the doctor says he wants anaerobic or gram stain. We're supposed to do it 3 different times. And it goes
Right.
different, right? Okay.
It's just like when it was on your old system, we used to get that. We'd get
I
a
don't know.
paper.
I just-
We got
I'm new.
we'd get a paper off of whatever the surgery system was that said wound culture, gram stain, fungus culture,
But I mean,
AFB.
you can choose it. I mean, I'm just saying you're supposed to do it 3 different times, right? That's what you're
3
saying.
different, yeah, it's 3 different tests.
5 different orders.
So when we get them down in the lab and they're all just under comments, we have to log in 5 different, because they're different
Well,
tests.
then it looks like you got 5 different specimens. You're sending one specimen, but you got 5 different.
That's the same as it was with the old surgery system. They ordered separate tests. So,
Sorry, Teresa. Didn't mean to get you slammed. Thank you, Teresa, for speaking up. We know we have some epic issues to work through, and we will work through them. So I'll work with Teresa, and we'll get with everybody on the little education piece after we get the issues fixed. Our next guest speaker is Elizabeth Appling, and she is here bright and early today to talk to us about diversity. Elizabeth?
Which all of you already know that we have accommodations at our facility, right? All of you use the phone or the BRI or call for an interpreter. I'm sure you have, and I want to hear about your experiences. I want to hear about anything you have to tell me today. I want all questions. Please don't feel slighted. I think there's some questions in the back too, so I want to hear those questions. I want to hear about your experiences. And also, could I get a copy of your sign-in sheet?
Yes,
Okay,
yes.
perfect. And that way I send another one around. thank you guys for having me today. I'm Elizabeth. I'm the Chief Diversity Officer here at Erlanger. We also have a Language Services Coordinator, Carlos Salazar. Some of you have probably met Carlos. And what I'm here to talk about today mainly is, we'll talk about diversity another day, but I felt like it was very, very important to talk about our Language Services Program. We are a federally funded organization. If you receive $1 of federal funds, we are mandated to provide interpreting services for our patients when they walk through our doors. This is a mandate. And it's the right thing to do also, so that we can make sure that we understand and make a reasonable accommodation for all of our patients. Some of you have probably used some of our services, the language services phones. Let's show of hands. Has anyone had problems with using the language phones at all? Do you all know where they're located? If there's any departments that do not have a language phone available, would you let us know, please? You have our contact information on the front of the brochure I just handed you. Also in your brochure, we try to think ahead and listen to some of your complaints and some of your issues and some of your to make things easier for you, because we know that at being clinical staff, we appreciate everything that you do, and you're so very, very busy. So we prepared this little small card to keep it handy, and it has all of our information on how to request those services at Erlanger. Our deaf and hard of hearing patients, our non-English speaking interpreter services, on-site foreign language interpreters, and video remote interpreting services. Some of you may have the VRIs, as we call them, the video remote interpreting laptops in your departments. So if you do, this is the information that you can request it. Also in your packet, we will go through all of these initiatives on the sheet, Erlanger Language Services Program training today, and I ask that you would sign the form and just hand them back to the manager if you would, and we'll take those with us and they'll be placed in a file in diversity so that when Joint Commission comes through, they can know that we did go over in 2018 with your department, and each one of you understands how to request an interpreter at Erlanger. If you look in your package on page number 5, let's go over some of these things, how to request an interpretation services at Erlanger. If a deaf and hard of hearing patient walks through the door today, who can tell me how to request that interpreter? Very good. You call 778 link. Or inside the hospital, you would call 4025. We have some very aggressive patients sometimes that comes through our doors, and they would like to pick up the phone and call 4025 themselves. But we prefer that you, the clinical staff, you are our experts. You know if the patient needs an interpreter or not. You know what services are needed for them, or if they need to request interpretation services for 2 or 3 days. So we would like for our clinical staff to request the interpreter. Spanish interpreters. We have Spanish interpreters on staff here at Erlanger, and we'd like for you to call the 4025 number for our interpreters here at Erlanger. The Spanish interpreters, we will send the interpreters. Yes, sometimes the interpreters are delayed. One thing I wanted to stress to you, don't get discouraged if the interpreter is not there in 3 minutes. They have to walk from the department, or they may be on another assignment. And all interpreting assignments are different at length. Some may last 5 minutes, some could last 30 minutes, some could be 45 minutes. But we'll get that interpreter to you as soon as possible. So what happens if a patient comes through our doors and then and they request an in-person interpreter, and that interpreter's not there in 10 or 15 minutes as you felt like they should be? You have what? You have your language phones, and you have VRI access. So until that interpreter, in-person interpreter, arrives at that
in your session, please use all your tools. Use your tools available until the in-person interpreter arrives. Yes, maybe the patient is getting upset. We found, just looking at some of our data, some of the older patients do not like technology. More of our younger patients will embrace it, but that's where we need your help. Just talk to the patient and let the patient know that we are required to provide this service. Mrs. Smith or Mrs. Martinez, please, we're going to bring this interpreting system up for you right now until the in-person interpreter arrives. And that's the same thing for the deaf and hard of hearing. We have contract with the Partnership for Family Services. The partnership has added on new services for us just for Erlanger, because Erlanger has, I know you know, our volumes have increased. Of course, we always do things on the back end, guys. We have to hire more FTEs for you because we are the hospital of choice, and that's all because of you. So we're going to make sure that we get more interpreters here, more tools here, more accommodations available for your use. And make sure you're trained properly to use those tools because we have more patients here. So just kind of put the patient at ease. When you're using the VRI, bring the interpreter up at the front desk on the laptop, then take it into the patient. That puts them more at ease. You're not, any kind of software that you use, it takes a while. If I don't use Epic every day, I'm fumbling going through the screens looking for the information that I need because I don't use it on a daily basis. So you don't use a VRI on a daily basis, so it's going to take you a while. Yes, there is a password that has to be entered. Yes, ma'am.
What's a VRI?
It's a video remote interpreting system. It's a laptop. You haven't worked here in a while? Okay, yes, look at your how to request interpreters and your little sheet I gave you. If you don't have one assigned to your department, you can call 7614, and that's the dispatch office on the first floor. Staff personnel requiring the use of video remote interpreting services for patient encounters will check out all necessary equipment from security dispatch by calling 7614, and these are available 24/7. Monday through Sunday, 24/7, all day long. We have that interpreting service available for you. If you get busy on your floors, if it's between 8 and 4, call our department, call the diversity department. We'll bring it up to you just to make sure that you have this reasonable accommodation for your patient. Any other questions about the laptops? Any concerns about the laptops? There has to be some concerns about the laptops. Has everyone had the ease of entering the password? Any problems with entering that password? Any problems with bringing it up? Internet connections? Anything on your floor?
If you do have problems, is there somebody you can call at that moment, or a resource to ask how to get through it?
Excellent question. The question was asked if you have any problems with the internet connection after hours or weekends, is there anyone you can call? Yes. I've had many discussions with IT. Just call the IT number. That is Anthelio. Anthelio knows. There's someone that always knows and someone that's trained to work on the VRI or your internet connection. We would like for you to put the internet connection on EHS Main Secure. Make sure that it's on Main Secure. We moved it from EHS Pub to Main Secure because it's a faster connection for the laptops. IT is very well informed, very well notified. We had some problems in the past, but this is very serious that we make these accommodations for our patients. Any other questions? Yes, ma'am.
You're talking about password. Is it our usual login or is there a separate password?
There's a password on each VRI. On the VRI machine, there is a password, and we placed it on the VRI. So when you flip up the top, Actually, before you even flip the top of the VRI, there's instructions taped to the top of the VRI. And also, when you flip the top up on the right-hand side, so that we can we wanted you to have ease and make sure that you saw the information. It's on the right-hand side also. On the look, it's taped to the machine about this size. Also, we ordered speakers for the VRI, the Video Remote Interpreting System, the laptop, so that the volume would be a lot louder and you'll be able to adjust the volume on each laptop for the patients and for your ease and for the doctor's ease. The language phones, you should have at least 2 or 3, it depends on how large your department is, located in your department. There should be language phones in your departments. We went to the cordless phones because the cordless phones are a lot easier and more accessible for you to take to the patient's rooms. And the 2 handset phones are also available. But if you need phones, just let us know and we will make sure that you have phones. We're looking at an upgrade probably next year on our phones. There are some new systems that have come out with our contract agency. So you may see a little change, but we will definitely make sure that you're all in service on the new equipment. Any other questions? Yes, ma'am. Okay. Pre-op hold?
And when they're gone after hours, where are they located? Are they locked up in their Pyxis, or are they still out, or?
Yeah, the language phones should never be locked up. They should always be readily available. Yes, ma'am.
Is it appropriate, we have staff that does speak Spanish, and we always call an interpreter, but in the meantime, is it appropriate for them to use them as an interpreter?
That's an excellent question.
We have several that are
Bilingual, you have bilingual staff, awesome. The majority of your bilingual staff has been trained, and by law, all bilingual Spanish interpreters should be deemed competent. All deaf and hard of hearing interpreters should be deemed qualified. We offer a competency course at Erlanger. Our next 2 classes, Part 1 and Part 2, will be at the end of this month, actually, February 28th and 29th. If there's someone bilingual in the room today that needs to be deemed competent, we need to have that on file. Please call us to sign up for that course. And the numbers are on the front of your booklet, of course. And to go further into that question, yes, you can use your staff, but we prefer that it's someone that's gone through the bilingual competency course for Spanish. We prefer that. Can you use those interpreters until we get an in-person interpreter here that's certified? Yes, ma'am, you can. But always call our interpreters. Our interpreters are our experts also. Even the deaf and hard of hearing interpreters that we send to you, sometimes, especially in the emergency room, we don't know when someone's going to show up on our doorsteps, do we? If it's an emergency. So there's not a deaf and hard of hearing interpreter here on staff. So we have to call partnership. Partnership's contract states that we should give them a 24-hour notice. But we cannot do that. So we worked out a deal with partnership that when we call them, they start working on that request, and they usually get someone here in less than 20 to 30 minutes. They try to get someone that lives in a local area, but if not, it may take 45 minutes to an hour to get someone here. So what do we do in the meantime? We use our tools. Use your VRI. Use your video remote interpreting system. Request that video remote interpreting system until the interpreter gets here. What about family members? No one in this room has ever used a family member to interpret for a patient, right? Please shake your heads no. If you do, I'm going to turn my back. No. But when can we use family members? Does anyone know when we can use family members? We can use family members for a short period of time, Just a short window until we request an interpreter, in-person interpreter for that accommodation. We should never use family members for an entire interpreting session for patients, because what did we say? We're federally funded, right? We're mandated to provide those services. And guess what? Patients know their rights. They will file a lawsuit, guys. They have filed a lawsuit. I have been in court. Yes, I have. But because of you and your excellent documentation, I'm glad I'm able to stand in front of you today to say thank you very much. You kept me out of jail. No. You kept Erlanger out of the newspapers. We were in the newspaper for a little while, but it all worked out because of your great documentation. Document, document, document. I know you've heard that over and over and over again, but if you have a patient that is just adamant about using their family member that's with them, or they brought an interpreter with them, guess what? Just state, we're federally funded, ma'am. We need to provide that interpreting service for you. We will request an interpreter. Call the interpreter anyway. Get our interpreters that we have on staff. Request our interpreters from the partnership. Get the VRI. Make sure you have our equipment to use for those encounters. You can start off using their interpreters, but you're going to go over all that information with them and make sure they understand before they leave our facilities. How about discharges? Discharges. You are calling for limited English proficient patients. You are using interpreters, right, to discharge your patients. Okay, good. But if you go to another floor, you already know. Ms. Applin said, use the interpreters to discharge your patients. If you have a surgery set up, please request an interpreter ahead of time if you can. Please request an interpreter ahead of time if you can. If you know that there's going to be a surgery at 8 o'clock tomorrow morning, let's request an interpreter yesterday, today, or whenever you make the appointment. You work hand in hand with the admitting department, the registration department. Let's double check on those accommodations for the patients. We have had instances where the patients show up and an interpreter has not been requested. Yes, have I received a call from patients or a patient's family saying, we're going to sue you. We know our rights, and we did not have an interpreter for this encounter. Yes, have I walked on the floor and there's been doctors writing notes or nurses writing notes to patients? Is that a reasonable accommodation? No, it's not. Patients will insist they can read lips really well. They can write notes for a small amount of time to go to the bathroom, walk down the hall, get water, request water, things like that. Something that's not medically, that's okay to write a note. But if you are if the patient is with the doctor, please, let's not write notes back and forth. Let's make sure we request an interpreter for that patient. There are instances, I know I'm going long, there are instances where we may have a patient that stays over a month. We've had patients that's been here for 2 or 3 months, but there's been special circumstances. So let's look at those case by case. I want to confer with you and the doctors to make sure that we make the accommodations for you.
We have several people that speak other languages like Russian and Chinese. Do you have a competency for them as well?
We actually can. Now, we'll talk about this off the record. But most of the time, since we do have the tools, let's use our tools first, number one. Employees will want compensation for that. So that's something we have to work out with HR. And that's something that you'll have to budget. So if you like to use your staff for other languages, we'll have to budget that and look at and get in a conversation with HR about that. I'm sorry it took so long. Any other questions that anyone has for me? Or if you want to talk off the record, I'm available for you. And I do appreciate you having me here so early in the morning. I didn't get my coffee this morning. No. But we did very well. Thank you so much.
Thank you. And the sheets that I gave you, if you could sign those and pass them back, I would appreciate it. Thank you.
Okay, just a couple of things I want to go over before we dismiss. Just have some new people to introduce and probably embarrass. Sabine Lumberg, she is a scrub tech, comes with experience going to the GYN team. Erica Payne, you can stand if you want. Erica Payne comes from the ER, experienced nurse, going to general. Renee Wilson, I didn't see her, I don't know if she's here. Tricia Sainsbury, I thought I saw her. She's going to general as well, so make sure you welcome them. Also, I just want a little update. I know yesterday we talked at Huddle about the trays, the instrument count trays, and so I promised Greg I would follow through on it and find out why the central sterile staff was just throwing it away. And Tricia said that it's for the OR's purpose, that the trays are tracked when they come through decontam on a separate thing because it's got a scan type of a thing. The incident reports that we've gotten when things are missing are, she pointed out some couple of things, so if you could just kind of help that will decrease some of the incidences and you being implicated that your tray was missing things. And one is make sure you put all of the instruments on the correct tray because sometimes they get split up, and so if tray A has one thing that's on tray Z, by the time it comes through 10 hours later, it just ends up in a pile as not missing because it was on the wrong tray. So that's one thing. Housekeeping has found hemostats and scissors and different things in the hallway that fell off the cart, so not sure how that's happening when you close them, and I don't know if they were on top or whatever, but anyways, housekeeping has found several instruments like that, so then that counts as well. But she is going to talk to the staff to not throw the papers away, and Tricia did reinforce that she does want you to continue as staff to do that final instrument count. If you have something broken, don't take it off the tray. Tag it and put it in the tray. Don't do it separately. Put it in the tray so that it can get processed and not come up missing as well. If you get a tray that still has something tagged for repair, you need to fill out an incident report because they're supposed to take them and replace them. So I know that's a lot for you guys, but please do that, all right? Linda, you have something? Oh.
We have badge cards that has all the micro labs on for you when they do get the Epic system fixed. I'm going to go ahead and hand them out. Also, the people that have been to the preceptor class, see us on the way out. We have a packet for you. And I'm not really sure how many people's here, but that's the nurses right now. We appreciate it. Thank you so much. We appreciate Elizabeth and Teresa. So, Z's got part of the cards.